Hello, friends. Today I'm going to share a small clinical tip. While using rubber dams, we can use this tip in cases where we are a little lazy to perform group isolation. So here I'm starting root canal treatment for 2-5. That is the second premolar in the left quadrant. So after removal of the caries, after access is done, uh, um, one can go for a pre-endo build-up. But if one wants to delay this particular build-up, this is a way by which we can go about. So I'm starting the video. Please have a look. As you can see, there is a clear gap between the rubber dam and the subgingival floor of the tooth. And if I use hypo immediately, it is going to leak through there. So I need to close this particular leak. Here I'll be using liquid dam. I'll be injecting just a little amount of liquid dam in between the sheet and the tooth. I'm using a DG probe to push the dam into the nooks and corners so that there's no void there. Light curing it. The next video that I'll be sharing is the entire case where I'll be performing a root canal treatment of this particular tooth. So you can have a look in my next video where I'll be performing the entire procedures starting from access till obturation of this 2-5. Here I'm injecting hypo and checking whether there is any leak or not. Once you are happy that there is no leak, we can then enter the next clinical steps confidently. Thank you. Please do like, subscribe my channel, and follow for much such contents.